I'm wearing my mask today because there's a lot of reporters here, and it's very hard for us to be 6 foot apart. And our guidance is that you don't need to wear a mask outside as long as you can keep 6 foot distance. But because that may not be possible for us in this setting, I'm going to wear my mask. So yesterday, I filed a temporary restraining order and declaratory judgment in my capacity as Dallas County Judge against our Governor Greg Abbott. Now, I'm seeking to hold portions of GA 38 regarding mask mandates unenforceable. But I want to start by saying the enemy is not Greg Abbott, it's not each other, it's not the unvaccinated. The enemy is the virus itself. And we all must do all that we can to protect public health. School districts and government closest to the people should make decisions on how best to keep students and others safe. I'll do all that I can to protect the public health and the people of Dallas County. And I hope others will join me in following the science and listening to doctors and the CDC and acting swiftly and decisively. I want to say something to our school superintendents out there. Martin Luther King said years ago that a great man is one who will not take part in a process by which a child can be harmed. By that definition, Michael Hinojosa has shown himself to be a great man in protecting our children at DISD. I hope that others will follow suit. As we will lay out today, the stakes are high for public health, for our community, and for our children. COVID is growing at an unprecedented rate. Now, over the last year and a half, we've come together from time to time for me to brief you on what is going on. The last few of those times have been positive, and it breaks my heart that today it is not a positive report. Today we must talk about what is happening, and we must work as a community to do what we can to curb the spread of the COVID Delta variant. Now, this variant is much more contagious than previous variants. Whereas our first variant, if I got the virus or you got the virus, on average, at its worst, we would spread it to 2 people. We're going to talk about that R factor later, but you remember the R factor, if you had an R factor, a replication factor, or an R naught factor that was above 1, then it meant that more than one person was getting it from each new case. If it was below 1, that meant that less than one person was getting it from each case. Well, at our very worst, in the beginning of the virus, with the first strain, it was 2 people for every 1 person that got sick. With the Delta variant, as you can see, it's around 5 people for every 1 person that gets sick. It is much more contagious than previous variants. Now, about 2 months ago, the Delta variant only made up 12% of the cases in Texas. According to the UT Southwestern's latest study, the Delta variant makes up 97% of the cases now in North Texas. Because of this very dramatic and in fact frightening trajectory of the increases in cases, the Public Health Committee voted unanimously to move to red on our COVID-19 risk level earlier this week and made the following observations in their recommendations. And I'll quote, "We have seen significant increases in cases, COVID emergency department visits, COVID hospital admissions, hospital census, and percent positivity. Hospitals are facing substantial staffing shortages. Over the last month, we've seen increases by 300% in COVID cases and 377% in hospitalizations. Dallas County and Texas substantially lag national averages for vaccination rates. In Dallas County, although 64% of our people who are eligible have had one shot, only 40.5% of the whole population, including children under 12, is fully vaccinated because, of course, children under 12 cannot get the shot. With about 51% of our total population having had at least one shot. This means that 59% of our population, including those little children that are returning to school, do not have vaccine protection. Now, the forecast shows that we have much to be concerned about. Models predict ongoing dramatic increases in cases and hospitalizations over the coming weeks that will exceed the peak earlier this year unless behavior change takes place. So, if we could go to the slides as they were given to me in the order they were given to me, I'd like to go back to the slides in the order that they were given to me, and I'd like to take people through that. There we are. So if we look at this slide, we're going to see what we're talking about here. If you look over on this side of the slide here, if you can still hear me, you're going to see certain dates, starting with Memorial Day, and what you're seeing with that green line there for Dallas, and I've got Tarrant on there as well, is this line is the R0 factor of 1. When we go below that, cases decrease. When we go above that, cases increase. I want you to look at one particular thing with me, and that is B. This is mask order put in place. When we look over here, and I'm a little far, I don't know if you can still hear me, I'm a little far away from you. Let's see if I can get over there. That's B. We were here. We instituted a mask order, and it dropped below R1. Now this is with a variant that at its worst only had a replication factor of 2. We are now facing a variant that has a replication factor of 5. But I hope this illustrates, and Dr. Wong will have some slides to illustrate it as well, the importance of masking. So we need to do all that we can, and I'm seeking to do all that I can to make sure that our children are wearing a mask when they go to school, and to make sure that your fellow shoppers are wearing a mask when you're at the store, so that we have our best chance of not getting COVID when we leave our home. Now, the models predict a dramatic increase in cases and hospitalization over the coming weeks that will exceed peaks earlier seen unless behavior takes place. Behavior change, that is, takes place. The increase will be more dramatic if vaccine increases, and I think this is one of Dr. Wong's slides, so if we could go to back to my slides, the slide 14, So if we look here, what we can see, and I'll kind of walk you through that, is where we are now. Okay? So right now, red is if you do nothing, and orange is what we're currently doing. So, you know, very little. There's not much difference, really, between those two, as you can see. Now, if we mask and socially distance, we would get back to where we are with green. Okay? If we do that, if we continue to vaccinate at the same rate, but we mask and socially distance, we could dramatically increase, or decrease rather, the spread of the Delta variant. What you're going to see, and I think it's in one of Dr. Wong's slides, is our biggest number, our biggest increase in hospitalization is 18 to 49, but concerningly, the numbers are going up for little kids and people over 65. Now, the most important thing, as we all know, that we can do is to get vaccinated. Because what we find is that when people get vaccinated, even though they're exposed to COVID, they're less likely to get it. In fact, of the people that we have been able to find who have COVID, now you may have some asymptomatic cases that are undiscovered, but of those known cases, 4 out of 5 of those are people who are unvaccinated at this point. And then when we look at cases that require serious medical intervention, it's 97 to 99% of those cases are in people that are unvaccinated. The other cases of the vaccinated tend to be people who have other issues, like they're in their late 80s, or they are missing an organ, or had an organ transplant, or an immunosuppressant type of a situation where the drugs are on are suppressing their immune system, or a disease is suppressing their immune system. So the vaccine is incredibly safe, it's incredibly effective. But remember what I said earlier, that the enemy is not each other. You know, I think we all know, because we've all got relationships in family and at business, that when you attack people's beliefs or you insult their intelligence, it does not make them more likely to do what you're seeking. If you are seeking to get a loved one to take the vaccine, and I want to encourage all of you to do that, let's get our loved ones vaccinated so they don't experience the heartache of getting COVID, getting sick, the guilt of spreading it to loved ones who get sick or even worse, pass away because of COVID. But you got to meet them where they are, listen to their reasoning, answer their questions in a spirit of compassion, love, and friendship. Questions like, how do I know this thing is safe? It's new. Well, it's 9 months old, and maybe older than that now. And what we've found with vaccines in the past is if there is a problem, it shows up in the first 30 to 60 days. So now 200 million Americans have been vaccinated, and it's safe for you. You need to go get that vaccine. People say, I've had COVID before, I don't need it. Well, unfortunately, your past case of COVID, if it was not the Delta variant, offers little to no protection against the Delta variant, and virtually none. And even if you had the Delta variant, that protection against the Delta variant will go away in a matter of weeks. And this virus is continuing to get more contagious and more deadly and come up with new variants. So the Delta variant won't be the last one we face, so get vaccinated. Now, the increase will be more dramatic if the vaccine rate decreases. However, If the vaccination rate increases threefold, that means 3 times what we're doing now, the epidemic will flatten and decrease. And you can see that on this side of the slide. So this whole box is lower from the beginning. And what this box represents is if instead of doing about 15,000 vaccinations a week, we did 45,000 vaccinations a week. So each vaccination makes us all safer, not just you or your family, but all of us. Public health and hospital leaders are concerned about these increases and what might happen in the coming weeks. Multiple hospital systems are predicting additional increases over the next month. While there's not a lot of good news on the trajectory of the virus, thankfully we can say that the vaccine is doing its job. But for our residents that are unvaccinated, this variant and this situation is deadly. Our healthcare workers are overworked, exhausted, and short-staffed. And while our COVID-specific hospitalizations are not quite at the record levels, our hospital staffing is the worst it's ever been. We've seen in recent news that an infant with COVID in Houston was transported to Temple, Texas by Waco because there were no pediatric ICU beds. Unfortunately for our region of 19 counties, we now have, for 19 counties, we now, at this moment, have 2 pediatric ICU beds. These are not just for COVID. Car wrecks and anything else, if your child needs ICU and a ventilator in a 19 county area, we have 2. The same could be said for our hospitals, which are at 90% capacity for staff beds. And these aren't just beds, as I've said, for COVID-19. These are all beds. So if your loved one has a heart attack or is in a car wreck, there's little to no availability. Doctors are already making decisions that are different than the decisions that they would have made 3 weeks ago about triaging the people that come into the hospital or the doctor's office. With the move to red, the Public Health Committee revised the guidance on how individuals who are vaccinated and unvaccinated should proceed. Consistent with CDC guidance, all individuals in areas of substantial and high spread, which at this point includes basically all of Texas, certainly all of North Texas, should mask in indoor settings or congregate settings where distancing is not available, and other areas where in contact with individuals who could be infected. Vaccines remain highly effective, especially against severe disease and hospitalization, meaning it is likely that many of these hospitalizations and ultimately deaths could have been avoided through vaccination. Vaccination prevents hospitalization and death. If you remain unvaccinated, you will be highly susceptible to the Delta strain as it increases in Dallas County. Increasing vaccination rates for those eligible is critical to reduce the risk of Delta and protect the vulnerable populations, including your children and immunocompromised individuals. Individuals who have been previously infected should still get vaccinated to best protect themselves in the community. Everyone vaccinated and should not mask. Everyone vaccinated should mask if you are in high-risk situations. Get tested regardless of your vaccine status if you have symptoms. Don't just assume you have allergies. Pharmacies, physicians' offices, and public testing sites are all options to get tested. I just got one of my tests, negative, back yesterday because of being around you. I get tested. If you are not vaccinated, stay out of crowds. Don't ignite a super spreader event. Here's the unvaccinated and child guidance is as follows. About 65% of our new cases are under the age of 40, and 80% of our new cases are unvaccinated. This virus is hitting our children, our young adults, and our young parents hard. We have Dr. Emma Dishner with us this morning, who is a pediatric infectious disease expert, and will speak more about what we're seeing in our youngest patients. If you're unvaccinated, please do not delay any longer in getting your vaccine. Over 351 million vaccine doses have been administered in the United States, and they have proven to be both safe and effective. This is too dangerous of a situation to wait any longer. If you're not vaccinated, experts say it's only a matter of when, not if, you will get COVID. Please take immediate action today to protect yourself, your family, and your community. Go to www.vaccines.gov to find a location near you. If you have a child that's over 12, please get them vaccinated if they have not already been vaccinated, as school is starting, and that's the best way to protect them. If you have a child under 12, they're not eligible for vaccine yet, but please do your part by getting them to wear their mask at school and getting yourself vaccinated, and ensuring all individuals in your home that are eligible for vaccination are vaccinated. Now, for businesses and private employers, you can take immediate steps to reduce the chance of spread at your business and help our community by requiring a mask and by incentivizing or even requiring vaccination amongst your employees. Now is a time that we must all make small sacrifices. Masks suck, but it's a small sacrifice to save lives, to keep our community and our country strong in this time of very high spread. Get your vaccine, wear your mask, listen to public health officials and doctors who just want to keep you and your family safe. And now I'm going to turn it over to our public health director and my friend, Dr. Phil Wong.
Good morning. As the judge mentioned, the situation definitely has gotten so critical at this point. I think we have some of the slides just showing the trajectory and the numbers of new cases. As you can see today, we're actually going to be reporting a total of 3,270 new cases. That's for the 3-day period of Saturday, Sunday, and Monday. But that's 3,270 confirmed and probables. So an average of 1,090 cases each day for the last 3 days. So you can see here, this is the trajectory we had before today's report, and how for the last week or 14 days, and then when you look at it in the context of 60 days, how that's just an exponential increase. The next slide again shows just as the rate per 100,000, what those cases represent, and again, exponential increase when you look at this in the context of the last 2 months. Next slide is just, this is the hospital admissions broken down by the age groups, and what's concerning, this orange line, those are the fastest growing group is in the 18 to 49-year-old age group. And what that reflects is that we've actually been very successful in getting the person 65 and older vaccinated, but it's in now these younger groups that are still vulnerable to the severe illness, hospitalizations, and death, as you heard the judge say. And so the exponential increases, and the fastest growing is in 18 to 49, but we're also very concerned that the admissions among 65 and older is also increasing similarly. Next slide. These are again just the trajectory for emergency department visits, similar exponential increases. Next slide. Hospital census numbers. I think yesterday we reported 682 people hospitalized just in Dallas County because of COVID. And according to the North Central Texas Trauma Regional Advisory Council, there were only 14 adult ICU beds available in Dallas County as of yesterday. Next slide. Again, this is the hospital census numbers of the percentage of hospital census numbers due to COVID. That dramatic increase, getting over 10%. And next slide. The admissions over 14 days, again, significant increases. Next slide. And this is our guidance document that we've had that has now been updated given our new status in orange. As the judge mentioned, I just want to wrap up by saying, I'm pointing out it's about almost 90% of the people who are hospitalized have been unvaccinated, and anyone who hasn't received the vaccine yet should take advantage of its availability. It's at your neighborhood grocery store, drugstore. I mean, you're hearing more and more of these stories, but I have to relate. I was talking to a physician over the weekend that was describing they're caring for a COVID patient in the hospital, and the patient had to be intubated. And right before they intubated this patient screamed out a big expletive and said, "I should have gotten the vaccine." You do not want to be that person. This is what we're hearing. This is heartbreaking. This is preventable. If you haven't gotten vaccinated, please do. This vaccines, as the judge mentioned, there have been over hundreds of millions of doses administered already. It is safe. It's effective. But, as with the Delta variant, it is also more easily transmitted. What we've heard is now that people, even if they're vaccinated, can carry the virus. It's effective at preventing severe illness and hospitalizations and death. But now vaccinated people can still carry more of that virus and spread it to others. And that's what we're concerned about. That's why still now the changed recommendations on masking. So please get your vaccine if you haven't. And again, as we mentioned, the new guidance are please, even if you're vaccinated, wear the mask indoors and still try to avoid crowds if you can. I think that's all I have, and I'm going to turn it over to Dr. Dishner. He's going to talk about some of the pediatric situation.
Hi, I'm Dr. Dishner. I'm actually an adult infectious disease doctor. I guess for my last name, it's Dishner. I work in the community, and just to reflect what's already been said, if you have the chance to go get vaccinated, vaccinate. It is the #1 way that we are going to overcome this virus. The vast majority of people I am seeing are unvaccinated in the hospital. And almost exclusively those admitted to the ICU are unvaccinated. I would say, aside from people having just regret and saying expletives, a lot of it is just sadness and woulda, coulda, shoulda when people are getting admitted to the hospital who had not been vaccinated. We are also starting to see breakthrough cases from the vaccine. Those patients tend to still do pretty well. However, it's sad that they have done everything that they are supposed to do, get vaccinated, socially distance, and they are still ending up in the hospital. Vaccination helps to protect you and your loved ones and the most vulnerable in this community. Vaccinating children over the age of 12, I would highly recommend with this upcoming school year. Those children and those under 12, I highly recommend continuing to mask. Those children, if unmasked and in close quarters, are most likely to bring the virus home, whether or not they get that sick or not, and infect other people in their family. Multi-generational households are going to be at the most at risk of being decimated by this virus. And I guess finally, I would just say, as a frontline healthcare worker in infectious disease, this is preventable. I think that has been the saddest part about my life in the last month, has been that I see people every day and this could have been prevented. And we have the chance to prevent it from getting worse. Thank you.
Your name is?
Dr. Dishner, Dishner. First name is Emma, EMMA.
Which hospital are you representing?
I'm here representing Dallas County Medical Society. Okay, thank you.
Thank you, Dr. Dishner. We'll take a few questions if anybody has any.
injunction and the case in the court system right now. What's your end goal, sir?
Okay. So the question was, what happens with the case that's in court now, and what's the end goal? So just a quick refresher. I was sued by Commissioner J.J. Koch, who didn't want to wear a mask in the Commissioner's Court. The Attorney General then sent me a threatening letter, Ken Paxton, and told the court that he planned to intervene in the action that Commissioner Koch had brought. So within that action, I brought a temporary restraining order, a request to a judge for a temporary restraining order against the governor, so that we would go back for a brief time, about 14 days, to that period before the governor restricted local authorities and school districts from being able to require masks. If the judge rules in our favor, then for that brief period of time until the case could be heard fully, there would be an order that makes that portion of GA 38 unenforceable. Then the judge would hear the case, and if the judge agreed, the judge could give what's called a permanent injunction. And that would be to say that the governor is enjoined from stopping local government from responding to this emergency. In a nutshell, our argument is that the governor and I derive our authority from Section 418 of the Government Code. It says that in matters of emergency, the governor can suspend certain laws that would impede the response to the emergency. So for instance, in the past, earlier, you saw the governor suspend laws to make it easier for out-of-state medical personnel to work on COVID cases in Texas. That is clearly within the rights of that order. What the governor has said now is, I don't want to respond to this emergency anymore, and I want to stop others from responding as well. But the law states that he can suspend regulations to speed up the response. The law doesn't say that he can pass edicts to stop others from responding. And so we say that the law as currently written does not give him that authority. Ultimately, it will be up to the judge, and I suspect appellate courts, to determine the validity of that. What I hope happens, though, is more local leaders stand beside Michael Hinojosa and others and say, enough, I'm not going to let children get sick and people die while I wait around to see if the governor changes his mind.
Judge, you said in your presentation that the trajectory depends on our behavior. How much of the governor's behavior is perpetuating what you're facing in this county and frankly in this state right now?
So the question was, how much of the governor's behavior is perpetuating what we are facing in the state? It's hard to quantify. I mean, you've seen in the slides, if we could have masking, you saw the difference, so that's the best way I can quantify it. Even if the governor were doing what his health advisors were recommending, the Delta variant is a very serious thing. But certainly by disregarding the health advisors, he had his hand-picked health advisors, not the people like this doctor or these doctors that we have in Dallas who are actually the heads of infectious disease at big hospitals or the directors of public health, but people who used to be, Republicans in the legislature or personal friends. Even with those advisors, he's now disregarded what they're saying, and he's looking at what Republican primary voters and donors and people that might support him if he were to ever run for president might want to hear. What they want to hear is that he's not going to require anyone to do anything that they don't feel like doing. But what I want the public to think about is, where would we be? Where would London be if people had exercised their personal freedom to leave their lights on during the Blitzkrieg and the bombing of London, right? So, yes, I've got personal freedom to do certain things, but my personal freedom is not such that it allows me to endanger you and your family. And so we're not asking people, you know, I don't know when this, you know, people in this country became so weak in their patriotism that they cannot stomach the idea of wearing a mask in the grocery store or having their child wear a mask at school. It's disconcerting to me when I see that and deal daily with tearful doctors and nurses who've just you know, been through a 2-hour a double shift and seen bad outcomes from COVID, or heart attack patients sitting in emergency rooms because they can't find a bed for them.
Judge Jenkins, it's not a pretty dire situation. Is it time to lock back down in your view?
What we're seeking right now is to wear masks. You know, it's an evolving situation. Oh, I'm sorry. Your question was, is it time to lock back down? The question was, it's a dire situation. Is it time to lock back down? What we're seeking right now is for people to wear masks in indoor settings outside their own home, and in those rare outdoor settings like the one we're in now, where people are bunched together. It's an evolving situation. It may be that with the next variant or with what happens, doctors will recommend other things. But if you look at the CDC guidance right now and the local doctor guidance right now, it is not to return to where we were in March of 2020. It is to wear a mask in its simplest sense. It is to wear a mask and get vaccinated. Now also, there is guidance for people, and we might throw it up on the screen there, a link to it on our website, on our county website. You can look at frequently done things. You're like, hey, I want to know if it's safe for me and my family to go to the zoo, or if I can go to a bar. And the information is different if you're vaccinated and unvaccinated, if you're over 65, if you're under 65, but you can look at that and see what the local doctor recommendations are.
You are at level red, and you talk about the action taken by the superintendent of schools here in Dallas ISD. What action should you and the Public Health Authority of Dallas County be doing outside of this executive order from the governor to ensure that you can decrease the spread of this variant?
So what we are seeking is to enjoin or to do a temporary restraining order and then a permanent injunction on those portions of G838 that would restrict us from having masking requirements and restrict schools from having masking requirements.
Can I ask the doctor?
Sure.
Either both, that would be great. That's okay. If y'all can come up here, please. So the governor took several initiatives yesterday to try and cut down on COVID cases in our state. I would like to know from each of y'all, is it enough? And how close, if at all, are we to seeing pop-up tents outside of our hospitals like in other areas?
I would just say that I think we're at the point where you have to mask inside or it's going to continue spreading. And then regarding vaccinations, I think you just have to vaccinate. I don't know if it is a matter of personal freedoms anymore. Go ahead. I mean, at least at my hospital, I have not heard about pop-up tents. And I'm not sure if other hospitals have had that come up yet.
And I just, echo that, and there's just more, we need to be doing everything that we can. As we said, it's preventable if we can get more people infected, but we need to do all of these layerings of the protection, getting people to wear the masks indoors, and when, even vaccinated people, trying to do this 6-foot physical distancing, ventilation and things, avoiding crowds, trying to avoid those situations. Everything is critical to addressing this, so it's really hard to, it's not all enough, and we've seen the projections of what will happen if we don't do all these things.
So to be clear, is it enough what the governor has done so far?
Again, it's clearly our trajectory on this is it's exponential growth. We need to be doing more, and that is not again what's been is done. We need to be doing and being aggressive in getting people vaccinated. We're now to the people who are most hesitant for whatever reasons, and if it, we're proud and respect some of these businesses and other hospital systems and others, the military that are making these now requirements. It's sort of that next level of what we have to do to be effective.
Dr. Wong, if the legal aspect of this from the county judge and others regarding this TEO is deemed applicable, in other words, if they adhere to his request, would you as the public health authority recommend for Dallas County a mask mandate?
Well, again, we will definitely work together, and that would be certainly, the masks are recommended now. That's CDC guidance. And so whatever it takes and whatever authority we have to do something to adhere to that CDC guidance and do everything we can to slow down the spread.
The reason why I'm asking you, sir, is because many citizens talk about talking to the health authority versus the political elected leaders. So from a medical standpoint, if you had that power, would you ensure that would be something recommended from the public health authority?
Absolutely. We want to use every authority that we can to effectively address this situation. So
you guys are talking about unvaccinated people. The vast majority of the people that y'all are seeing are unvaccinated. Are we talking about children who are unvaccinated, or are these adults who are sick? And what's the worst age group that y'all are seeing right now?
So I work in an adult hospital, so I can't specifically speak about children that I'm seeing because I'm not seeing them. However, with the adults, I have plenty of people admitted to the ICU who are in their 30s who have no other medical problems. And I think, at least at my hospital, we have also seen an uptick in pregnant patients where it makes their pregnancy, which had been otherwise going okay, a much more high-risk pregnancy. And then regarding children, I know that our ICUs are very full in the children's hospitals, and so even though there is the thought that COVID doesn't affect children that bad, when it is your child and you don't have anywhere to go except for a very far away place, I'm sure that will feel differently.
Yeah, and the question was about, the vaccination rates, or is it a problem just in children? And as we showed earlier, that we've done well in the 65 and older, but it's that younger age group, including younger adults and even kids in that 12 to 17 age group that are, the vaccine is approved in the emergency use authorization for that group. There's still a lot of kids in those age groups that are eligible that have not been vaccinated, and that's why we're seeing those numbers. I think yesterday we reported 55 confirmed COVID-19 pediatric patients hospitalized in our trauma service area E, which is as high, some of the highest levels of pediatric patients we've ever treated in this community. So it is a problem, and that does reflect the lower vaccination rates in the younger populations.
A lot of times people are telling us, hey, I don't want to get the vaccine, I want to wait and see what the side effects might be. Like they're talking about, like, I want to wait like a year. And I think we hear that so much in our field. What do you say to those people who say that they want to wait and see what happens with the rest of us who got vaccinated?
I would would say at this point, it's probably a matter of how you're exposed to specifically the COVID mRNA and whether or not you want a small dose in a vaccine or you want to be exposed to a much larger dose out in the community, and how you want to protect yourself and your family. I think I'm vaccinated, my family's vaccinated, I'm breastfeeding. I think that anyone who can get vaccinated, we're trying to protect yourself and others, and millions upon millions of people in the U.S. and worldwide have been vaccinated, and I think it's a safe vaccine.
Yeah, I mean, definitely echo that. I mean, the question was, what do we tell these people who say they want to wait a year or something later on this vaccine? There have been hundreds of millions of doses administered. It is safe. It's extremely effective. Now what we're seeing is these unvaccinated, it's preventable. I relayed that, the episode I was just told about this weekend, the unvaccinated person being intubated and then, screaming out and saying, I should have gotten vaccinated. We're hearing more and more of these stories of these people who are getting in this situation and then recognizing they should have gotten the vaccine. Don't wait. Now is the time to get it. I mean, it's available. Early on, we didn't have enough vaccine around. We've got availability. Other countries would love to be in the situation we're in. And we should take advantage. I mean, there's no reason not to get it right now.
We have time for one more question.
Dr. Wong, did you see this surge, this current status coming? It was just maybe a month or so ago when we saw basically what was defined as minimal infection numbers on a daily rate. At what point did you see an indication of concern regarding this variant in this community?
Well, definitely. I mean, we were following and we saw the Delta variant. We were hearing what was happening in India and other places, and so we, was absolutely of concern. And these numbers are reflecting that. It's a change. It changes the game, and that's what, I think we all have to, from the very start, it's been a change. We have to be able to respond to whatever is coming up, and the situation has changed daily. The Delta variant certainly was a game changer in terms of how we have to deal with it, and that's sort of what we've experienced, and we still need to be prepared for whatever else does come in the future. So,
how worried are you about the new school year being a super spreader? I mean, when we talk about the IFD.
Very. I would say without having masks, children, especially those under 12, I would be very concerned if my child was of age to go to school. And for those who do have children that can get vaccinated, they should get vaccinated to protect themselves and their classmates and their teachers. I do worry that there's going to be spreading events that will disrupt our school years and make it harder for children to learn.
And definitely, I mean, the vaccine isn't approved for kids under 12, so they can't get the vaccine. And then the fact with the Delta variant, how easily it spread and how easily we're seeing the spread, I mean, it's a combination that's very, very concerning.